that part, but that's fine, I guess. Okay. So I'm going to teach you what the green is and help you understand that part. And also I'll give you some of the red areas that I believe that are important based on previous experience, that things actually came from. Learn this local concept. You don't have to learn everything about it. For example, let me see if I could find you an example. Let me see here. Like, let's say a concept in radiology about, I don't know, cosmic x-rays. I'll tell you, memorize this. Doesn't mean you have to go study the whole chapter about that topic. This is what because if that question comes again, it'll come the same way, hopefully, and you'll answer it. That's how you increase your chances, but focus on the green. So only go into details if you see a question asking about those details and memorize that part. We're always going to come across new concepts. That's not going to change, and we are here to support you. I can't answer all the questions you have about dentistry. I mean, that's impossible. And I cannot compete with Google. So that's why we don't like research in class. It becomes very chaotic if someone does that. So there's no point. I'm here to give you what I know you need and not necessarily what you want. And that's something that may kind of, some people won't be happy with that because their expectation is they're coming because they want to learn how to become a prosthodontist. And I'm going to be like, look, you don't need to become a prosthodontist to pass. Okay, if you want to become a prosthodontist, go get a specialty. I'm here to teach you what you need to pass and also become a good general dentist. If there is something you think that is important, go and you could research it on your own, and you could form study groups with your classmates. A lot of people in class do that. And the thing is, you'll have more time to look into extra stuff if we're solving the green part for you, right? If we're teaching you this green part and making sure you get that, you have more time to look into little details. But also, I recommend that you stick to the green. So I kind of draw it like this sometimes. Imagine this is me here, okay, and I'm just giving my instructions. And the knowledge I have is, let's call it H, right? Now, you're all dentists. You're not fresh, people into dentistry. Like, you're not first year dental students. You're all dentists. So you all have your own unique knowledge of dentistry, right? So let's say this person has knowledge C, right? This person has knowledge, I don't know, B. Let's say this person has knowledge M, right? Just giving you guys a specific, unique, symbol for knowledge for each person, right? Now, the job of the course, because I'm experienced in AFK and passing the AFK, and I have a team that does that, we're trying to deliver our knowledge H, okay? So we're delivering this knowledge. So what's going to happen is you're going to have a combination of C and H, which is unique. And you're going to have a combination of C and H. And you're going to have a combination, B and H. And this person is going to have a combination M and H. Now, things are nice and dandy when the H and M, for example, for this person, agrees on certain things. However, when H doesn't agree with M, the concepts, that's where conflict happens in your mind. Your job is to kind of figure out, why is there this conflict? Maybe you could ask me and I could answer that question for you, and then it solves it, right? But sometimes old habits die hard, right? So you might have a previous concept that's wrong and I have to correct it for you. Sometimes you just don't want to accept the new concept, and that's fine. You could kind of make your own combination of my knowledge and your knowledge, and that's up to you. I do think for the exam, use what we have, because my knowledge is already a combination of previous year experiences, especially from my staff as well, like Dr. Hajar and Dr. Sharif, everybody. So you're going to have, and also ACJ knowledge, because I kind of use things from there. So I think for the exam, if there's a disagreement between your knowledge and my knowledge, take mine for now for exam purposes, unless you just feel better to take yours. You could do that if you want, but that's at your own risk, right? Now, here's what I'm not here to do. My brain cannot take your knowledge, B, I can't take B, C, I can't take M and combine it with mine. That's too much. I can't do that. There's no time for that. it is a one-way thing. So I'm mainly delivering my knowledge to you because I'm helping you pass, right? I do learn some things from people, but honestly, most of the time, if it's not useful in clinic, personally, I delete it because I don't want extra things to hold in my memory. Or if it's not, if it's something really AFK oriented for me, I probably won't do it as well because I'm not taking AFK. Excuse me. So it has to be something I feel like is very important for the students. Then I'll keep it to teach it. But for my personal knowledge, I'll be honest, I'm not looking for anything to learn mainly because you might have wrong knowledge. I don't want to take it from you. If it's anything from clinic, I honestly take it from continuing education courses like ortho, someone that's teaching here. I'll take that for clinic. And for AFK, I might take from you if you have a really good point, and that could help me teach others. But personally, I won't mix it up with my knowledge, so I keep it clean, just in case there's anything wrong. So that's why it's easy. It's better. You're all going to have different ways of thinking. You're all going to have different knowledge. And I don't want you to blurt out your concept that are personal because that may mix up with this person and this person. And what happens when this happens is that this person is going to be like, Dr. Hafez, do we need to know this? And I'm going to be like, not really. So you see, you might confuse others and you might make others feel that they're not studying or they're missing out on something. So that's why just let me deliver my knowledge, take it, mix it up with your knowledge, make your own combination. If you have any questions, you can ask us privately and then we could decide if what you want to add is important or not. So one of you may know more than me in a specific area, which kind of represents like the C here, right? So please do not mention detailed information in class because it may confuse others. If you have detailed information about the red area that you want to share, you could send it to me in an email and we'll check if it's important for the AFK. Please do not share random info in class because it could simply be wrong or not important enough, and it confuses everyone and makes them feel they are not studying enough, right? So you could throw out a concept. Let's say you throw out a wrong idea. This idea may become pinned down in someone's head, and then when they see options, they might pick it and it may be wrong. So it's very sensitive, the mind, to these things. Okay, that's why I don't like people throwing out random things. I try to say things very, very carefully to make sure I'm saying the right words that represent the ideas. So to be honest, if your additional information is not solving a controversial question and it's not helping anyone, so let's just not care about it. Okay, that's just the truth. So we try not to care about additional information that each person has. Everybody's going to have their own unique experience because classroom time is limited. You're free to make your own study groups and do that stuff on your own. But in the classroom, my job is to deliver what I have to everybody. And if you have something nice to say, you could praise in public, but criticize in private. So if you find us that we made a mistake in something, or you have a correction, contact us privately. Don't just blurt it out. You could simply be wrong again. Or if we find that you have a good point here and you have a good reference, we will change things. We're very, very transparent. We really feel a great responsibility in delivering things to you properly. We don't have, our goal is not to be right all the time with you. We want to give you the right things. We want to be right, but if we're wrong, we'll admit it and we'll send it out to everybody and fix it. So talk to us privately first so that we could research it and confirm. Then we'll change answers if we need to. However, don't blurt things out in class saying that this is supposed to be the answer or because of this and that or because you read something once a long time ago. That just confuses everybody. Prepare your evidence first, then tell us, this is why I think this is the answer. Support each other, but don't neglect yourself. So in classroom, the environment, guys, is really great in class. We always have good classrooms, I think, and good people. The small class environment is really cool. I really get to know everybody, and we talk, and we have a lot of fun as well. And I really encourage, if you could make it to class, it's the better one. I think it's just enjoyable. If you can't, the online is good. You get the forum as well, and I'm going to show you a demonstration of that later. Another thing about competition, support each other but don't neglect yourself. I do encourage spread of knowledge, but remember, you're the one in a tricky position right now. This exam is a competition. I'm sorry to say, it's a competition. You're racing against people. You're not all going to make it to the top together. So this is why we keep our classroom small. So you guys all should help each other inside the classroom, because if you don't, it'll feel weird. You don't want that awkward feeling. So build friendships with people in class, help each other, give each other knowledge, do whatever you can to help each other, but try not to get involved with many people outside. Some people go to people. So I know people like take this course and then they go and try to build some sort of relation with someone from a different course, right? And now they're trying to share knowledge. One thing that could happen is this person could share more and this person could share less. Now this person has more. Second thing is there could be conflicts or contradictions and confusion. And once that confusion happens, you can't take two courses all at once and master them. You just can't. The better thing to do is take one thing and focus on it. Whatever course you take that person's course and focus on it. That's what I recommend. Okay? So try to support each other be on the same team. Care for your classmates, help each other out. If you want to share with others outside the course, it's your choice. You're just harming yourself, I think. I saw people do that and it never works. They think they're getting the best of two worlds, but they're not. Okay? They're people that have done that before, I saw them fail. Remember that may not share, and they may not share the same with you. So it has to be very planned. And what you're doing is you're giving your competition more, ammunition, basically, right? Or you're helping your competition. So you're only responsible at this stage for your own success. This is my advice. You may have care for others more than what they care for you. And after you pass, honestly, go help others. Go tell them what to do. And you can just tell them, look, I recommend taking this course or that course or whatever course. Help them that way, right? It's not your responsibility at this time to teach. You're not becoming a teacher. You're not making it your job, right? So hopefully that's some tips for you. And I want to address some coaching things here. Why do people fail? Now, you could say some of it is knowledge. Yes, if you did not prepare, if you did not study, if you did not take a course, it's going to be knowledge probably. Most people fail because they answer average questions wrong. So if you take Scholars course, I'm saying if you take this art course, you shouldn't answer average questions wrong unless there's another reason you have. And I'm going to explain why you would answer average questions wrong, even though you know the answers. So usually people don't fail because they answer difficult questions wrong. They don't fail because of those. Difficult questions will determine if you're a 90 or an 80. Something like that, right? Someone that answers the really difficult will bump their mark up. But someone that screws up an easy question will bump their mark down. That's the thing. You must learn what most people know. So you have to focus and see what's everybody learning. This is why I say if you're not taking a course, study the decks. Because if you want to know what everybody else knows. So let's say everybody, right? Everybody's pattern is like this. Right? This could be, let's say this is resto, pharma, right? Prosto. Let's say it's like that, right? And that's the pattern. Let's say you choose to go and do your own thing and you're well, I'm just going to do different, and your pattern maybe is lower here, maybe it's lower here, maybe it's higher here, maybe it's well, okay. So now if there's a question in Prosto, maybe you got it right, maybe it's a difficult question, but they probably get it right too. However, if you're different than everybody, you may get easy questions wrong and average questions wrong. You may get that hard question right, but who cares about the hard question being right? That's not going to help you pass that much. You can't screw up the average questions. If you screw up the average questions, your mark goes down. If you get the hard questions, your mark goes up. Okay? It goes up meaning that, imagine your baseline is 75, right? If there's a difficult question, right? If you get it right, your mark goes up to maybe 80. If you get it wrong, you'll be at 75. They just won't reward you for it. Imagine it's like that. However, if there's an easy question and you get it right, you stay at 75. But if you get it wrong, you'll go down to 65. And if there's an average question, then that could bump you up or down. Does that make sense? So easy questions will not, if you get easy questions right, it doesn't help you. It doesn't increase your mark, but if you get them wrong, it'll decrease it. If you get average questions, that's where things could go either way. But difficult questions, I don't think getting them wrong will decrease your mark, but if you get them right, it'll increase your mark. Does that make sense? That's why you can't screw up the easy and average, because that's the baseline. Difficult questions only give you more, but they won't take away from you. Okay? So, I don't think if you take a course, that's what I mean by you must learn what most people know. If you focus on learning what others don't know and you forget what everybody knows, the baseline, then you're probably going to not make it. That's why I say focus on the green. If you take this course and study hard, knowledge is not the reason. So there's two things, taking the course and studying hard. If you just attend, that's not knowledge. You have to attend and work on retaining that info. So let's say you have the knowledge pinned down. Let's say you've done the best you can to retain that knowledge. Why would you answer average questions wrong? Well, here's things that could happen in the exam. So if you follow our methods and instructions, you'll pass. Why do people mess up with average questions? Here's what I think. Fear and stress, confidence and expectation. These three things are the things that I thought of that could affect you in the exam. Now, fear and stress could cause what we call, you could probably see it in sports, choking, right? And choking means, what does choking mean? It means something you could easily do, but because of the pressure, you fail to do. That's choking. So choking is not just, getting a hard question wrong. That's not choking. Choking is, you know the answer, but for some reason you answered wrong, or you couldn't find it in your mind. That's choking. And that happens when you become distracted. And you become distracted when you start thinking in the exam, how am I doing? Okay? Instead of thinking, just do. Right? So, in the exam, your state of mind should be non-judgmental. Do not judge yourself in the exam. In the exam, you have to be just, I'm here to solve these questions. I'm here to solve. That's it. Solve. Oop, this one's difficult. Circle. Move on to solve. Come back to solve. That's it. No judgment. If you start thinking, oh my God, I'm not doing well. Oh my God, this is not right working. Am I doing well? Am I getting this one right? Am I getting this one wrong? That's distracting and will cause you to forget your answers that you have. Okay? Again, I that was in a book called The Science of Performance. So it's for athletes, but it applies to everything, right? So the reason you choke is because you start thinking how you're doing, and that builds anxiety. And then you could start, not only that, you start to think of each step that you're doing. Are you doing it correctly? So you want to just do without judging yourself in the exam. So the first thing is fear and stress. I believe you need the right amount of fear to keep you studying. You need to fear. You need to have some fear, but not much to stress you out, right? So, there's two things that motivate people, right? There's hope, and hope will kind of pull you forward to do something. You hope you want to become, the general dentist. That's what you want to do in Canada, right? So you have the hope that will pull you forward. And then another thing that motivates people is fear. And fear is a stronger motivator. So fear will push you forward towards the goal that you want, right? And it's a good motivator. It's not a terrible motivator, because fear, what are you afraid of? You're afraid of what could be if you didn't pass. What would you be, right? Failing and not being the thing you are. So some fear will help you, motivate you to push you toward the goal, make you work harder, and hope as well. So both of them are good motivators. Fear, scientifically, is actually a bigger motivator than hope. Just to tell you guys. So some fear is okay. It's okay to be afraid, but you also have to control the fear. So you have to control the fear in a way where you use it to make you study hard, and then you know how to eliminate it so that you're not stressed. And that's the key, right? So it's the fear is going to push you towards studying, and then when you're in the exam, you have to be like, I'm okay. Whatever happens is fine. So use the fear. You want the fear, as long as it's controlled, use it to motivate you to study. So how to manage the fear? We all are dentists, we're all scholars. We want to enjoy learning the concepts that our dental schools never taught us properly, right? So you could manage the fear by, I'm not afraid to fail because I'm not studying mainly to avoid failure. So that's a way to manage your fear. I mean, you just have to play these tricks on your mind. So you start saying, so when you're feeling too relaxed and you're not studying, you have to, allow the fear to come to you so that you can get up and study. But when you're stressing out, then you have to be saying, well, what's the worst that could happen? That's fine. I'll be okay. I'm enjoying this. This is a fun process. I'm just learning. So there's an opportunity to actually understand really cool stuff about, who cares about the exam? You could use this kind of thing. Who cares? Just an exam. They can't judge me. You need a method to relax. Some people do yoga, meditate, take breaks, maybe religious, whatever works for you. Have fun. Life is just not about AFK and dentistry. Sometimes you could remember that. Life is just not about dentistry and what you're doing, right? There's a lot to it. I mean, if you made it to Canada, that's good enough, right? Like, it's a really good country to be here. And that it's on its own an amazing thing. And you don't even have to be a dentist here. You could do anything. Like, there's so many other things you could do. You could become like a project manager. You could become there's so many other things. You'll be fine, right? So that's a way to kind of eliminate the fear. But also, if you want to become a dentist, then allow it to work to motivate you to study. So it's a controlled fear. Now, the other thing is confidence. Now, also, you need the right amount of confidence. If you're overconfident, this creates ignorance. Oh, and I see this. And people, I'm going to be honest, it's usually people that have experience in work environments. So if you graduated a long time ago and you worked for so long, you probably got to the point where you're like, oh, I thought, I just know everything. But that's not it. You actually don't know anything. You forgot everything. That's the real reality, because this is academic theory stuff, not real life practical stuff. And if you're overconfident, this will create ignorance. You won't study enough. You'll study something once and think that it's fine, I'm good, I'm done. Like, I know it already, it's easy. So it's not good enough. Lack of confidence is also bad. People think that this is a good thing. This is where people get tricked. They think that if I'm studying and repeating more, it's better. No, because this will lead to unnecessary reading and repeating, right? Which wastes time. And yes, there is such a thing. I believe there is such a thing. People think as long as I'm studying, I'm okay, right? Like, I'm studying 10 hours a day. Or see, I'm doing very well. No, are you studying in a practical way? So there's something called deliberate practice. And deliberate practice means today you're studying. What was your goal from today's study, right? What was your goal? What are you trying to do from today's studying? What was the accomplishment that you did? What can you say that you did at the end of today's studying? And that's something that will help you in skills as well. What's your goal? You have to improve yourself. And this is what athletes do when they want to become better as well. They know from this practice what exactly they're trying to accomplish. So from today's studying, what are you trying to accomplish? You can't just say, well, whatever it is fine, as long as it's more hours. What if you're reading something you already know? You think that's going to help you? It's not. It's just wasting your time. So you need to know exactly, are you reviewing? Are you learning something new? Are you trying to research something, gathering information process? Are you in that process? Are you eliminating things you already know? Are you looking for things you already know and trying to eliminate for the next time you could review? These are all different things. And I tell people at the end of the course, research time is over. Now it's review time. And when I say review time, people told me, someone asked once, what's the difference between research and review? A huge difference. You're not researching new things and you're not accepting new information now. Just learn, review the old information you already took in. So you have to know what you're doing. When it comes to lack of confidence, this is why you waste your time. So how to manage confidence? Decide when to be confident. Also, you have to control this. right? It's all about controlling these things. So back to like fear and stress. If you're stressed out in the exam, that's why you lose clarity, and then you can't answer the question. Now confidence, if you read this is a good objective way to kind of do a little study on yourself. Okay, so if you read pathology this week, okay, so this is you, and this week you read pathology card number, let's say 52. Okay, then after 2 months, so let's put 2 months to make it visual. It's time to read pathology again, and you got back to card number 52. Okay, and you'll find out what knowledge you remember and what you have forgotten. So you're reviewing this card, and you're like, hey, I already know. It seems like I know everything in this card. Does that okay? So this is what just happened. This is what you observed. Okay, so this little project, this little objective observation, or this observation here, doesn't this mean that moving forward 2 months, you should remember the card number 52 within that 2 months at least, right? So it may be even longer, because this is a second repeat. So maybe here this is your second time reading, 2 reads. Maybe this is your third read, right? But on your third read, you remembered card number 52 from 2 months ago. So that means objectively, you should remember it moving forward 2 months, or even longer than 2 months, even 3, right? But you don't know that objectively. But at 2 months, you should know it. So any reason you forgot it within the next 2 months is something else. It's probably like fear or expectations, or maybe you didn't sleep well, something else. It's not something that was in your control, because logically you should have remembered it. So what if the AFK exam was here within these 2 months? That means I don't have to study card number 52. You get my point? So now I know from here to here, I remembered it. So that means I should be confident. I have to choose to be confident. Confidence is not something just like it comes. You choose to be confident that I should know this card in this AFK exam that's here. So I don't need to read it during this time period here. I don't need to read it again or review it. I don't have to include it in my review. If the AFK exam was over here somewhere, maybe after like 2.5 months, maybe I would then keep it, right? Because I'm not sure about that. But this is what I mean by choosing when to be confident. Do these little projects on yourself and you would know. So this is the things you forget. Have confidence that you'll remember a portion of them next time. So if you forget totally card number 52 on your third read, then just know that next time you'll remember something. You don't remember usually 100%. So don't assume you're going to remember everything. Expect to forget. And people get depressed because of this. They come to me after their first read and they're like, we forgot pharma. I'm like, that's normal. Don't feel bad. Just try to review it. It'll come back. Now, here you're choosing to be confident in this scenario. You don't want to be overconfident because you want to give yourself time to repeat and study. But also you don't want to lack confidence so you don't, over study things. However, in the exam, always be confident. Just be confident in the exam. Choose to be confident. Okay? Assume that you have the knowledge to solve the question. Don't say you don't know. So let's say there's a question. Sometimes this happens. There's a question, and they just bring a new word. There's a new word in this question that you never heard before. That new word triggers something in your brain that makes you think that this is a new piece of information. You start looking in the wrong places in your brain and you don't answer the question correctly. Don't let that happen to you. Assume you know everything about this question you need to know to answer it. That new word may be irrelevant. Honestly, I'm telling you, the monolithic zirconia thing, some people went monolithic, oh no, they freaked out. But really, if you just eliminate the word monolithic, you'll just be left with zirconia, and you already know that zirconia can't be etched. So it's the same thing. So try to eliminate some new word to see if it makes a difference in the question. That's a good technique. And we'll train you during the course to even answer questions, even if you don't know exactly what the answer is, some ways like that. And the third thing is expectation. Expectation, I would say, have high hopes, but be realistic. Don't be, I know everybody thinks they're going to get 100%. This is what they're like, you know what? I'm going to be the guy to do it. No one's done it. I'm going to be the guy to do it. I hope you are, but just don't expect it, right? Sometimes that 1% hurts you so much that you feel like that hurt will kind of cause you to make more mistakes. If you see a new question in the exam, or a difficult question, or something you never heard of, this could break you and cause you to mess up. So we'll practice exam strategies. That's what we do. We practice it in mocks to help you manage that. So how do you manage expectations? First of all, walk into the exam expecting to be confused about 50 questions. Honestly, that's the average. That's the average, guys. I tell my students, look, you're going to do all this work and you're going to come to the exam and leave with 50 to 60 to 70 questions that you're like, what was that? This is the average. And even the people that get 90 say that. They circled 50 to 60 questions. This is the average. Expect that. Don't let it hurt you. Imagine they're bullets and you just have to dodge them. They're not the real questions. Imagine they're fake questions. They're just there to be tested out. They're not really going to evaluate you. They just want to see, hey, this is a fake question. Can you ignore it? You know, like think of it like that. And when you see one, just smile and think, I'm sure everybody else is having a hard time with this, and just continue with your exam, you know? And remember, try to dig in your knowledge. Assume you have the knowledge to solve it. You might find it, right? At the end of the day, you have to manage yourself. We're here to help. We can't force you to pass. You're the leader of yourself and your success. So you see how much there's individual things that you have to manage on your own part other than knowledge, but we're here only to be part of your success story. And that's pretty much it for the AFK part. Now, I'm going to get into a little bit of history just so that you guys know who I am. If you guys, like, I think it's important to know who's, you know, we're going to spend 6 months, so you probably want to know who's this guy, right, that's going to teach us for 6 months, and his team. So just a little history on this, and then we'll get to some demonstrations. I really want to show you guys the demonstration part. I have that saved for later. Everything is okay, guys? Okay. Okay, so I'll just tell you a little bit briefly about what I did to get to this point so that you understand I'm not just like, you know, randomly just some guy trying to teach you without really having a history with knowledge of this stuff, right? So in my third year, I studied in the University of Damascus in Syria, and that was like around 2008, 2009. And somehow during that year, I realized that, you know what, I'm going to become a dentist one day, and I better know what I'm doing. I just thought, that's what I thought, honestly. I'm like, I feel like I don't know what I'm doing yet. And the school years are passing by, and I'm always waiting for this year where like something clicks, where like someone just teaches me everything I need to know. And I realized that's not going to happen. It's just going to keep being the same. Year one pass, I'm like, okay, what was that? Year two pass, I'm like, okay, I learned stuff, but I don't know what's going to happen. I don't know what I'm doing as a dentist, I felt. So I learned that it's just going to keep going that way, and I don't think these guys are going to teach me what I need to know to become a good dentist. So I really just took on the responsibility on myself, and I decided to make my own schedule and learn on my own, and just use the university to pass, right? The university will teach you how to do some things, but they won't teach you why, when, always, like the details. You have to work on your own. So that's what I did. So my first concept was, okay, well, I have to first learn oral medicine. I feel like I need to know how to diagnose oral diseases, and if I spot cancer or something that looks abnormal, at least I could refer that. So I worked on that. And then I thought I should learn how to diagnose pain. People come to the dentist for 3 reasons, I think, right? Pain, function, and aesthetics. I could get to aesthetics later. That's fine. Function, well, yeah, we'll get to that. But pain is number 1, I think. So I need to know how to diagnose pain. So I learned that. So I thought I should learn that. Diagnosis and treatment of infections. So what I mean by infections is like perio infections, endo infections, you know, decay. That's all infections. Abscesses. And then you could get to the restorative mechanical phase, right? Like that's what dentistry is. And I look at it, even when I talk to patients here, there's a way to talk to them to explain like these things. I tell them, like, if you look at teeth, there's 2 things, mechanical and biological. And the biological could affect your gums and your teeth, right? So as long as your gums are protected, you're doing the cleanings, and your teeth, you're getting the x-rays to make sure there's no decay, I feel like you're good from the biological standpoint. But how about the mechanical? If there's attrition, if there's any occlusal disharmony, it will be a shame to lose your teeth due to that if you have good biology, right? Good biological component. So how about we make a night guard or something, and that way you protect your teeth from wearing down, and also just keep doing the cleaning and you should be fine, right? So you can kind of split it down that way. So now the restoration phase, you need to understand occlusion and how to restore a single tooth and multiple teeth. So in my fourth year, I'm like, okay, I'm going to start with oral medicine. I studied Burkitt's Oral Medicine. It was a great book. I think it was really good in explaining how diseases are, so you kind of understand good philosophy of diseases. However, it's not a good book for AFK, to be honest, because it's not organized in a way where you could kind of, it's difficult for AFK. So that's why, and I don't think it's on the AFK list or on the NDEB list, but it's a good book in general for oral medicine. And then in endodontics, that was my year 5, where I felt like pain comes from endo, really from the pulp. So let me see how that works. So principles, I read this book, Principles of Endodontics, and I started diagnosis, and I looked at everything that was questionable to me. So I wanted to understand physiology of pain and oral pathophysiology. So I went to books for that as well until I really understood C fibers and A delta fibers, and I started to understand pulp pain and the treatment planning as well. And then at that point, I came back to Canada. So I already lived in Canada before, but I came back to Canada 2011, 2012, and I started to take on now occlusion and perio. So I read Carranza's book, most of it, some like parts are important, and Dawson's book, both are good books. Carranza is really difficult, but it was important, I felt, to get all the diseases under control in my head. And I only gave myself 1 day a week to do that. And then I started to prepare for my exam, my AFK exam. So I started reading Dental Text Part 2. And then I'm like, well, what's basic science? What is that? What do they mean by basic science? And now we're the only course that actually has a proper basic science. So I knew I needed to strengthen this. So I decided to determine what basic science do we need as dentists in the general practice. So I started thinking about, well, connective tissue and epithelium, because that's what we do surgery on, right? And oral histology as well. So I focused on the cells of the body. I thought if I could understand all the cells in the body, wouldn't that be easy to understand then the tumors and the diseases? If you know how things work normally on a cellular level, you could kind of know how they work on a pathological level, right? So I went through all these books and some videos as well, and I summarized it. And then when I saw the release, I went like, oh, okay, now I could relate what really is important. And then I took pharmacology from USMLE, which Part 1, which is really good, I think, but it's pretty extensive for dentists. So I kind of took out what I needed from that, and then I combined it with the Dental Dex Part 2, and I made a lecture for pharmacology. And pathology, the Dental Dex Part 2 is pretty good, but I combined it with my understanding from Burkitt's, because Burkitt's was a really good philosophical way of understanding things. And we use other books like Neville to research. Neville is a huge pathology book. And I find pathology is all about repetition, so you just got to keep repeating. Occlusion, I said it's from Peter Dawson's book. And then treatment planning for missing teeth, I got that from Contemporary Fixed Prosto. So there's a treatment plan if you're missing one tooth, two teeth kind of thing. And we're going to learn that in Fixed. And then how to restore a single tooth, that's just doing crowns basically, right? Or fillings. Dental materials, I collected everything from the Dental Text Part 2, organized it, then went through fill-ups and filled in the gaps and then understood it. Then 2013, I took the exam. I got 91. I was very, excited about that. I started teaching with other companies. I made a bunch of lectures, so you might see my name on some other companies that also, if you have old lectures for other companies, they're still using some of my lectures as well. You might see my name there. And I found that people are finding the same things that I found troubling in university. They're having the same problems, and now I have the solution. So I felt really good about, offering that solution for people. And I started working as a licensed dentist in Canada in 2014. I kept making some lectures then. And then in 2015, I focused on gaining experience because I felt like that was the missing thing in me. So I'm still working right now, and I've done all these courses to kind of give me more strength and everything. So oral surgery, wisdom teeth removal, implant courses, occlusion, Invisalign, AIV sedation, nitrous, oral sedation, medical emergencies, a CBCT for implants. Already put implants here. And currently I'm registered in an orthodontic course. And I completed then, I took some time to complete all my other lectures and then I put it all in a book, and I prepared for my first course, official course on my own in 2017. And then I just realized that, this is something I want to keep doing. So I converted all the lectures into a booklet style so students could actually carry them easier, and reduce the days I practice. This is how the books look like. So what we're not just gonna, I don't know how other online courses work, but I'm not just gonna give you like an article or something. Here's your material. We're actually gonna ship you these books if you're online. We're gonna ship you the Foundation of Dentistry books. Just another note is that we don't do them in color. So if you want color, there's an additional fee. I don't recommend color. I'll tell you that for AFK. For ACJ, you'll need color, so we do that automatically. So what's our plan? Someone was saying what to start with, what subjects to start with. And I'm going to show you what my plan is, and then you could decide what you want to do if you don't take the course. But if you take the course, you're going to be forced to use our plan. So what's our plan? The way I designed the schedule was something I had to think about for a long time. I kept thinking till I finally found what I think is one of like a perfect schedule kind of for me, I think. Not personally, but like in a scientific way. So first, we should start with basic science, okay? It's the first thing. It's basic science. It's the most difficult thing, and it's good because it'll give you some things for everything, and then throughout the remaining of the course, you might need to go back to it. So I learned it, and I'll teach it to you and relate it to dentistry. You must become the scientist. I feel like we should be scientists. This is why here, people, when they go to school, they go to undergrad first, and they learn sciences, and then they go to dentistry or medicine. So undergrads here know most of this stuff, guys. They know what dopamine is and serotonin. So this is 2 days, which means like basically 12 hours. So it's going to help you mainly in all other parts, especially pharma and patho. So you become a scientist before a doctor. That's how I look at it. And then after that, we can get into the medicine stuff. So now we have the proper background to go into pharmacology. Imagine I teach you pharmacology and I just teach you the basic science in the pharmacology. You're going to be really confused. And the strategy here is to give you the basic science, repeat it in pharmacology, and then teach you the pharmacology and patient management. Pathology, and then anesthesia. So now we got rid of all of the big, heavy scientific stuff, and now you became a doctor. I think this is the medicine stuff. So this will help you become the doctor. Patients expect you to be a doctor. You're a doctor here, guys. You're not just a dentist, right? You're a doctor before you're a dentist, by the way. A dentist is not a lower, it's not doctor and dentist. Doctors here, general, they're called physicians, right? A doctor is, you are a doctor, right? You're not a physician, but you're a doctor. And a dentist is a specialty of a doctor. You're a doctor of the mouth, okay? You have to look at yourself like that. And then at the end, I go through the engineering stuff, which is dental materials, prosto, restorative, ortho. So this is what makes you kind of like the dentist. Now I delay ortho to the end of this schedule because it's not as important. These are mainly what the GP does. So that goes first. And then we go into the surgery stuff. And you do endo, perio, and then we go back to ortho. And then we do surgery and radiology. Sorry, implants is with perio. So you're going to find that it's very well, the schedule is very well organized for you. So at the end, once you're done this phase, you'll become the doctor of dental surgery, right? That's why we're called doctors of dental surgery. Okay, so let's look at what the course has compared to other courses and maybe compared to our own course in 2018. So we've done a lot of new things in 2019 that's still going. Basically, we have lectures. Some courses don't even have lectures. They only do questions, but most of them, I think, now have lectures. But some of them don't. So we're going to actually teach you stuff. And then we have questions and answers. We want to do that extensively. We always had that. Facebook support, we always have that. Final mock exams. Yep, we have 3 full mocks, and we're going to work on making a 4th one. Online mocks as well. Now, if you do the online course, the online mocks may not be as much or as many as the in-class. So everybody that does the online course is welcome to come to in-class. We're going to work on a platform to provide that later if we can. But for now, the strategy is what we did this. So the online people, they get basically 3 half mocks, so which is like a 1.5 mock, and the in-class people get 3 mocks. But what we did is we sent the notes that are about the mocks to the online people so they have the information, and the in-class people still get the online mock. So in class, it's if you could make it to in-class, come. Even if you did the online course, you could still come to in-class and do the mocks. Alumni discounts, I don't know other people do this, but we always done alumni discounts. So right now the course in class is 4,000, the online is 4,400 with shipping. Like shipping is included in that. However, if you take the course again, it will be 2,500. So that's like a good discount. Online videos, no, I don't know any other course that has online videos, and we didn't have it in 2018, and we did work really hard to include it in the 2019, and I think it's a really, really amazing thing to have. Even our in-class student get the online videos. You could rewind. No one does this. Everybody else is doing live. They want to do live stuff so that, but we recorded, we edited the video, and now you can rewind, repeat. You have flexibility, you want to watch it. I think that's an advantage that no one can provide. We have an online forum, which is better than Facebook because you can search better. And I don't think other courses have that. And we didn't have that in 2018, but we have it in 19. And then we have online quizzes, which is a before and after quiz. So you get a quiz before the lecture, after the lecture to see your improvement. That's something we also implemented. Our passing rate in 2018 was around 80%. We don't have this, our stats are not finished yet to finish 2019. We're still waiting for our recent students now to get their marks, and we're going to see how they did. But eventually we'll come up with it once we're done this course. Okay, and we usually try to we give all our students bags, so we usually send this within the package to our online students. Now we only ordered this time 50, and that's going to be distributed for in-class and online. So it's first come, first serve. The people that register, we will send this to you, and then if it runs out, then we may not be able to send it, or we have to wait until we get the new order. I really, please guys, this is very, 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 very important. If you think you're going to take the course, register early. It takes, if you're in Canada, it could take maybe 2 to 3 weeks to get you the book shipped to you. We have to print, then ship, and package, and then ship. If it's international, it could take anywhere from 4 to 6 weeks. Okay? So please, if you want to register, try to do it as soon as possible. We'll try to get it to you. But don't worry too much about missing the first part of the course. We always compensate later on, and I'll show you a demonstration. So this is how our membership area looks like. I think, okay, so this is where the demonstration comes in, guys. Cool. Okay, I'll show you the membership page, the registration process, how does the unclass course work and the online course work. Okay, so let's discard this. Let me just first see if everybody's still okay. Am I still talking to people, or did you guys disappear? I don't know. Yeah, okay. Okay, I'm just looking at like you could summarize the material. I don't know about summarizing it, but what I think is you should cross out what you know already. So as Dr. Hasher is saying, like things are laid out pretty well, but what you want to do is you want to eliminate things that you know on your third reading. So when you come to the end, you don't have to read everything, right? So everybody's here. We're going to do a demonstration of, I'm going to show you guys the website. How many people do we have in? Okay, so can you guys see the website? I just want to make sure you guys can see this other screen I have. Okay, so perfect. Okay, so let me just, so this is the membership area. Once you get a membership, memberships, by the way, there's a free membership, so you just click on members and then it'll say please put an email and password. So you click on it and it should work, and then you get here. Okay, this is the membership area, the free area. So there's a little demo I have here for how the video player works. You kind of click here and you could pick what video you want to watch, and then you play, and
eventually that's going to cause pain, and then eventually, or hyperemia, so increase of the blood supply to the pulp.
So this is how that looks like. Now this is the membership area, so you have all the free stuff here, pharmacology review, things on YouTube, and some of these were recorded a long time ago, so like I don't know, this one maybe is like old. Let me see how it was. Oh, it wasn't so bad. This was, but yeah, you can see how it was, because it was recorded a long time ago or a while ago. The microphone wasn't best, but most of our lectures now, if you go to the samples, you can see how they are.
So you have a normal pulp, right? Where in two ways.
So this is how we're trying to record.
Congestion, a lot of blood supply coming in as a reaction to irritation without.
Now you're not going to see it on YouTube. So once you register, you're going to have access to most of these tabs, right? You see these sub tabs here. So you could go to videos. That's where the AFK videos are. And it looks like this. Okay. So you're going to see like this screen. You're going to have your name here for recording purposes. And then you're going to have all these. You see, we have basic science 1, 2, pharma 1, pharma 2, pharma 3, pharma 4, everything all the way here. And right now, I only have these two activated. So you click on endo. Oh, there you go. You just click it back and play. See, this is a 3 hour and 40-minute video. You could forward, you could pause. Okay.
And then when it mineralizes, planned indirect pulp capping. Histology. Okay. C fibers could have radials.
You can see also Dr. Hajar kind of tilts the camera toward the board when I'm drawing when we were recording. So it's pretty like extensive. So let's go back. That's the videos basically. And the way the course works is for the online people and in class, it's all the same. So let's say we take the in-class basic science on Saturday and Sunday. On Monday, the basic science will be uploaded, and then you have until the Monday following. So you have a full week, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and Sunday to watch basic science 1 and 2. Once that's done, these will be deactivated, and then pharmacology the next weekend will be activated. So the people in class have access to these videos, and the people online have access. The cool thing is I also keep updating things. So if there's anything I need to talk about, I will record a video and upload it. So when I do that, like for example, there was a new classification of perio that came out, and so I went and studied it, and here it is. So I uploaded it for my students, and it took 50 minutes.
Anymore. It's easier. It's about
I even put subtitles with it.
Look at the tooth now.
Right? So this one's slide sharing. And they were talking about zirconia, and then I told them, okay, I'll research zirconia and give you more details. So I did that. It was maybe a 25-minute video, see? And the voice is very crisp here because I'm using a high-quality mic.
As aesthetic as a glass structure, and when it's with oxygen, pure zirconia.
And I actually recorded all the ortho this way. So if you guys, some people prefer the in-class look, some people prefer the slides. You'll get a mix of both, but the information is comprehensive. Okay, so you did the basic science, right? Let's say I'm a student, I'm an online student, I'm registered with ScholarsDental. This first weekend is basic science. Now it's Monday, so these should be activated. Before you do that, you should go to the quiz center and you should do the pre-lecture quiz. So this is our AFK quiz center. You click here and then you see pre-lecture quiz and post-lecture quiz. And then we have at the end we added some practice tests. Now, the pre-lecture quiz is something you do before the lecture. So let's say you're going to do it maybe before epidemiology. So before watching epidemiology, you could do this one. But before watching basic science, you do this one. You click on basic science. Oh, there you go. Now you have a quiz. You do this quiz, you get your mark. Now the pre-lecture quiz, you don't get what you answered correctly, because I don't want you to know yet, because this will stimulate curiosity, and curiosity will make you learn better. Okay? So you want to use the course right. Now, once you take the basic science, so now you go back to the videos, and then you're supposed to watch the basic science. And then once you finish the basic science, you go back to the quiz. This is over like maybe a week, right? You're doing like a week of work. And then you could go to the post-lecture quiz. It's pretty much the same quiz, but now it'll give you the correct answers. So you try and you compare your mark. You see, did you improve or not, right? And what parts did you not improve in? So that's the quizzes. And you can see we have quizzes for all our weekends. Even if it's pharmacology split to 2 weekends, we have 2 quizzes for each weekend. You see? This one's going to be more focused on cholinergic, adrenergic. This one's going to be antibiotics and analgesics. So it depends on the weekend. So that's our quiz center. Awesome. Now you have a place where we upload articles. So these are all the important articles we use. Very important, such as prevention, infection control, from the RCDSO, anything that's Canadian and important. Also, what I added here is something, I did this for our students. It was very unique this time, but I created a study plan at the end. So the study plan basically included what they should do in the last 2 weeks. So I told them, okay, here's the study. This is what's going to happen. You're going to take this lecture. You're going to study this. So it was like a last month kind of study plan. I told them the last week you should leave it for these subjects. We really work hard for the students. We always do things, okay, maybe we should do this for you guys. And we always do things on the spot, So I decided to make a study plan for them. And so we might do that again. And then we have the mocks area. This is where you do the online mocks. Now they're deactivated, so they're not going to work. Mock 1, Mock 2, Mock 3. And you scroll here. And then you have the forum, guys. So look at our forum is very, very active. It's 26,000 views on our AFK forum. There's 949 posts. Okay, so you click on AFK, and this is where you could ask the questions that you need to ask. So you can see each subject here. We have a place for all the answer keys. So once you get things, you're going to have all these answer keys, right? So let's say basic science. So you have all the questions and their answers. You see? Perfect. And then you have people asking questions maybe on specific things, and then you could go back to answer. So we have an answer key area for all the questions. And if there's any topic we need to make, like new 2019 released, basic science, pharmacology, pathology, all the subjects are here. Fixed prosto is just included with this section here, so we should just delete this section. Research fundamentals, I guess, is included with basic science. So you can see we have, and the cool thing about this is you could look at previous discussions that occurred, and this is exclusive to our AFK students. So let's say you want a question about, I don't know, what do you guys want? Someone throw in something. Oh, when will the online course start? It will start with the in-class course. So let's say I want a question about, I don't know, composite. Who asked? I'm looking for a question about composite. You can see all the discussions that happened about composite. This is talking about, and then Dr. Hajar, great job. She's worked so hard on the forum to build it, and it's already built. So you'll see she has almost answers to every question. So that's why I recommend always look for your question before you start asking, because you might just be repeating questions that have already been asked. So Dr. Hajar has been answering everybody's questions on the forum, making sure everybody is informed. What you want to ask about, I don't know, necrosis. Maybe you're looking for a question about necrosis. So you can see anything that has necrosis in it. I mean, I think it's pretty good. And that's the forum. So we also have an ACJ forum for our ACJ students. And if you do decide to take our ACJ course as well, our ACJ course is different, but it's the same way. We have videos online, and they're always activated. And we keep updating. If we need to update more info, we'll just record a video and update it. So I have even like case discussions here in class. We have case discussions like this where I just discuss
250. Okay.
like that. And we also have like just radiology close-up analysis.
Absorption. I'm just reminding you.
So this is just this is how our platform looks like. And the videos here, let's say you came in and you missed the first weekend of basic science. Usually we have a holiday somewhere, and during that holiday we upload videos that have been from the beginning. So I think we have a holiday maybe after pathology. I'm not sure for this schedule, but the basic science basically, let's say you missed basic science or pharma because you were late or something. We usually upload the first videos somewhere back in the holiday so that the people that came late get it back. And that's pretty much it for the demonstration. That's the members. You guys know about this stuff. So you can see the current AFK schedules here, but this is only the current one. And then if you want, go to AFK courses for registrations to show you how the process is. So you can see this is for the online orientation. Yeah, so our AFK process, you just go to register. And I'm going to show you some things where you could find things because some people have trouble with this. So AFK courses, you have in-class, online Canada, and online international. So the in-class people are people coming to class and can pick up the books on their own. Okay, so it's 4,000 plus tax. Now online Canada, which is, you guys are going to be either online Canada or online international. This is 4,200 because we take in consideration shipping the books. Okay, so if you want, you can, if you're like not too far, you could come by, pick up the books and register for in class and just watch the videos at home. If you understand what I mean. So you could be an online student, but really you're coming to class to pick up the books. So you register for in class, you pay full, and then you could go back to wherever you are and just watch the videos and treat yourself as an online student. So the 200 extra here is mainly for shipping and packaging and handling, because we try to do it soon, and each area may be different, but we have someone working on that. And then here, the online international, we also charge 400 extra for the shipping mainly, and on also like all the extra work that we do. But if you want to take the in-class, you can. You could pay for the in-class if you decide to come pick up the books, but also it has to be organized and proper. Okay. Now you could go here and just, you could make the payment there. You could look at all the other features, and if you want, you could go to, if you want to schedule, this is where you go. See schedule, download here. That's pretty much it. Okay. I think I've covered everything pretty much. I'm going back to the members area, and again, don't forget to watch the YouTube parts if you want. And look, we have the orientation from 2018 and 2019. I would recommend you checking those out, because I do say things differently every year in a way. I might have some errors are the same, but I may say things differently. So I think it's a good idea to see those, and that's pretty much it. Let me get back to you guys. Okay, so back to the slides now. All right, so again, guys, this is some classroom etiquette that we will have later for our in-class orientation. And the last thing we have is the epidemiology access. Dr. Hajar is going to send you an email with the link. There's no password this time, just a link. And just thank you for coming to our orientation, everyone. I'm going to start taking on some of your questions. Wow, it's... Okay, let's see. So I think there's a lot of questions here, so let's try to... Oh, so for the online Shahrazad, for the online mocks, there will be written explanations for them. So the online mocks, the way they look is you'll get the answer, you'll have the mock, you answer, and then you get the correct answers immediately with an explanation for each question why there's an answer like that. Okay. Yes, Timmy, we're done pretty much. You could go now. I'm just going to stay around for anyone that has questions. You're welcome. Okay, I'm gonna stop sharing the screen just because I think it's easier to see your questions when I'm doing the whiteboard technique, I think. Let me see. No, it's the same. You're welcome, guys. So Dr. Deeptha, you're saying, can you alternate between online and class? Yes, you can. Just let us know which one you want mainly, so that we know, should we accommodate for you in class, and do you need shipping? That's our main concern. Do you need us to ship the stuff to you, and or are you just going to do, or are you going to come pick it up, and do you want to attend in class so that we know how much space to have for you, for everyone? Okay, you're welcome, everyone. Well, that's better. Okay. Thank you, Jose. Hope to see you soon then. You're welcome. Remember to watch the YouTube, and we're going to link you the epidemiology. You're supposed to watch it today because tomorrow we're going to close access to it. So don't.